Bonjour. Bonjour tout le monde. On va commencer dans quelques petites minutes. Hello everyone. We're going to start in just a short bit. I'm going to share at least this. In the meantime. Hi. Hi, Sulema. How are you?
I'm good, and you?
Very good. So we're just waiting for Miriam right now. Gonna give her another minute. Hello, everyone. We're going to start in just 5 minutes. Miriam is getting off another call, so she'll be joining us shortly.
Hello.
Hello. Hi, Miriam. How are you?
Hello. Hi. How are you? Hi, Sulema. How are you doing?
Hi, Mariam. How are you doing? I'm great. And you? Good to
Busy,
see you.
busy. Long back-to-back days. So
Yeah.
sorry, I'm just from one panel to another meeting to ordering hand washing facilities. So yeah, it's a lot of things. But apologies. I hope I've not delayed you too much.
No. It's just been a couple of minutes. So it's great that you could join us. So we already have a couple of people with us. Why don't we just wait about 1 minute and then we'll get started with intros and we'll just dive in. Yeah. And I'm just gonna make some quick announcements.
I have not, I mean, I could give you a presentation if you wanted to, but I hadn't planned on one. So up to you.
Yeah, I think it's more of a conversation. We just want it to be light and fun. So yeah, that should be good.
Okay, all right, sounds good.
So yeah, so I just wanted to give some.
Let me know when you're.
Okay, perfect. I'll just give some brief logistic announcements. If you have any questions while we're talking and during the webinar, please feel free to put them in the chat box. We'll be reading all of the questions from there. I'm just gonna send a quick hello there so everyone can see the chat box. Please put all of your questions, comments, feedback, go through it there. The second piece is that while you are not speaking or during the whole webinar, if you can keep your mic on mute, that would be great. And last thing, this webinar is recorded, so we'll be sending the link, and if you want to watch it later, you can either go to HTSpartners YouTube page or Facebook page to rewatch this great webinar. I'm excited. So we're just 3:05. Should we get started? I'm going to start with intro. I'll introduce myself and HTSpartners, and then I'll pass the mic to you both. Yeah, thank you for joining again. So I'm Hafou Touré-Sam. I'm the founder and CEO of HTSpartners. And HTSpartners is really, it's an advisory firm. We really want to lift and show the real potential of SMEs in Africa. And how do we plan to do that? We want to provide exceptional advisory service by giving these enterprises very targeted and custom-made solutions in specific sector that they need to grow. So those sectors are really in terms of, one, their investment readiness, but also strategy and business development advice, also technical assistance to not only build their capabilities in terms of even human capital operation, but also financial. And we do believe that with all of these put together, they can actually grow and scale and become regional champions. Now, why we've started these bi-weekly webinars is that we realized that with COVID-19, a lot of these enterprises are going through a lot. They don't know what to do, they don't know how to do it, and we realized that we do have some expertise that is out there, either from our team at HTSpartners or even with experts like Miriam and Sulema that can come on these platforms and share these advice with other businesses. My background personally is in actually the financial sector. I worked in the financial advisory and also in development, and with a lot of private organizations like Deloitte, but also with development institution like the World Bank, but also the African Development Bank. So in thinking about how these enterprises can come together and bring about a solution with this COVID-19 crisis, that's really how we got about to bring this team to you all. And I'm going to open the floor. Sulema, you want to introduce yourself before Miriam? And then,
Sure thing.
Yeah,
sure thing. Thank you so much for having me. I'm so happy to be with you. It's so good to be speaking to you. I hope you all staying safe and positive. My name is Sulema. I'm economist, and I'm talking to you from Abidjan. Miriam, the mic is yours.
Yes, hello, hi. My name is Miriam Sidibe. I'm a senior fellow at Harvard Kennedy School, and I am currently the co-founder of the National Business Compact in Kenya, as well as an author of a book called Brands on a Mission: How to Achieve Social Impact and Business Growth for Purpose. I am foremost a public health worker that believes in the power of the private sector and trying to do good. And it's never been tested as much as during these trying times of COVID-19. So I'm really looking forward to this conversation to bring back and give back to my own continent. I'm originally from Mali. You know, I'm married to an Ivorian, so for me, Cote d'Ivoire is home. Even though I am currently based in Kenya, and Kenya is benefiting from a lot of my experience and the fact that I'm grounded here.
Awesome. Awesome, awesome, awesome. So part of the discussion that we wanted to have today, Miriam, we really want to tap into your expertise, not only in the health sector, but in your experience in the private sector and even with bringing businesses together and actually fighting this disease. So I wanted to introduce the concept of corporate social responsibility, which has been around for quite some time, but has never been so much talked about lately, especially with businesses coming together to help resolve this unprecedented crisis, right? So what is corporate social responsibility and how should we understand it? So there's many definitions out there, but the one I'll be using is really the most broad one that you find maybe on Google and Investopedia. It's really thinking about it as a business model that helps the company be socially accountable, not only to itself and its stakeholder, but the public. So this is when they actually are thinking about the impact they're having on all aspects of society. Previously, it could have been only economic, but now they're thinking about the social and even the environmental aspect. And the social and environmental aspect have taken a big leap these days, right? Environmental because of climate change and everything that is happening around us, but social also in terms of what is the social impact of your business. So when you think about this crisis and how companies can be more socially responsible, what does that look like? And how can we think about that?
So, yes, no, I wanted to just comment on what you said.
Yeah.
And the for corporate responsibility. I think, you know, corporate social responsibility is a concept that's been around for a long time, and a lot of companies are, you know, thinking about what I'm calling today stakeholders capitalism, which is, you know, looking at a variety of stakeholders, whether you're looking at your obviously your shareholder, your supply chain, you know, who's actually helping you, all the way to the communities and the people that are buying your products. I personally do not like the concept of social responsibility and CSR. What I really like, and I'm sorry, I'm going to trouble you a bit with that, is I really, really believe in the concept of a shared value. And what do you do in terms of creating business models today that are really going to try to not only look at social responsibility, philanthropy, or even sustainability, but a new way to achieve economic success? And because what you need to do is to look at the way those companies are looking through their products and value chain and through economic development. And the way my book is positioned is to move away completely from some of these corporate social responsibility models, but to really think about how do you create these business models that are at the core of businesses and what businesses can do to achieve social impact. Now, I think, you know, whilst the CSR as a terminology it needs to be rethought through, the way you look at it is not necessarily, you know, there is a role for philanthropy, as you would call it, in terms of CSR. There is a role for core business, and there is a role for philanthropy as well. And there is a role, obviously, for policy engagement. Now, in a world of pandemic where we are today, businesses have no choice but to look at not only where they sell their product, if they want some sort of business resilience and continuity to happen, but they also need to look at, you know, how are they going to take care of the communities who are also the consumers in which they sell their product. So, you know, and I will talk to you a little bit later on the National Business Compact and what I've created in, you know, in line to what I'm trying to do, which merges both core business response as well as philanthropy. Because when you think about what I'm trying to talk about and what's needed today in terms of prevention, you're looking at things like, you know, hand washing and hand hygiene, right? Hand hygiene is the best line of defense in terms of COVID-19, making sure that people are washing their hands. Now, who has been getting people to wash their hands for centuries? Soap manufacturers and businesses that have been producing soap before Christ and that have been thinking about, you know, how do they get to every single village and to make sure that soap is available in 99% of households. So now the second biggest important part is how do you get people to wash their hands? Because soap access is not going to be the issue. The biggest issue is going to be making sure that people have access to to soap, to water, and to hand washing facilities in their home. And 3 billion people around the world do not have access to these free things in the same place. And we know very well that even when people have access to running water and they have access to soap, like let's say in Europe or in the US, the global rates of hand washing with soap is less than 19%, which means that 4 people out of 5 still come out of the toilets without washing their hands, even when they have all this water and soap. So therefore, behavior is going to be very difficult, and even more difficult in the concept of our countries, where low income, you're dealing with people having to be 12 in a home. They do not have access to individual toilets or sinking sinks and so on. So this is where, in this particular instance, you need to look at philanthropy and core businesses. So how do you harness the expertise that some of these soap manufacturers have, and making sure that they keep giving the access to the products during this time, but they're also bringing more around the environment. So making sure that they're cooperating with some of the water companies to reduce water bills, or actually waive water bills during this time, that we are making sure that people have access to hand washing facilities. So to go back to your question, is CSR the answer? No. But is CSR coupled with core business coming to the table and really wanting to make a difference? Yes. And this is what I'm talking about when I think about, and I will talk later on about my book and Brands on a Mission, but it's how do you couple and make these business models happen that are tapping into core business, philanthropy, and joining coalitions, so you can have real policy engagement to make sure that businesses are doing what they need to do, but they need to do it at an accelerated pace and much more inclusive of the low-income communities today.
Yeah, so exactly. So I think what you're really trying to say here is that businesses need to move from this corporate social responsibility concept and actually include it as part of their core strategy and their business. It shouldn't be like a second thought, as has been portrayed lately, right? It's like, oh, let's do some philanthropy, let's do some good outside of our core activities. This CSR, or even it should be innate into the mission of the company. And as they work through these, it should not be a second thought, and it should really be part of the core business. Agreed. And I mean, you're definitely going to talk about that later in terms of how can companies really transition, because we already have tons of companies that aren't following this model, right? So how do they transition from their current model to this model of being mission oriented? And Sulema, you kind of wanted to talk more about what the private sector can do and what's available out there, right?
Yeah, exactly. And I really would love to build up on what Mariam was saying. Because of the COVID-19 crisis, livelihoods have been hit hard. Many businesses have been forced to close, and many jobs have been cut off. Leaders all over the world are looking for ways to muffle the shock of the health crisis, but also to stimulate economies. They're like fighting on two fronts, saving lives and jobs, which are pretty much linked with. So for me, the biggest challenge is to balance between health, to survive, and jobs. Because if we are not healthy, we cannot work, and if we don't have a proper job, we cannot afford healthcare costs. So now going forward, one thing that should comfort us today is that as this virus has no borders and frontiers, so will its cure. So I'm pretty confident that we will find out a treatment and a vaccine and so on. However, what I'm more concerned about is the transition. If we will transit or not. And here where I can build up on what Mariam was saying, we need to think the path forward that we need for our future. We will wake up one day from this crisis, but we will need to figure out how to build new models and so on. So many things have been done, both from states, governments, and development institutions, namely providing cash flows or many instruments, and postponing the payments, etc. Also, many private sector leaders and CEOs have shown much appreciated support to their communities and employees, and not cutting salaries, and providing funds and providing help, going remotely even if when it's not mandated. So, but what this crisis is telling us is that many vulnerability will be exacerbated aftermath, and many jobs will be lost. We will lose many jobs, and for this we need to boost our economies, to boost the economy growth. Let's say recovery. We are not looking for growth anymore. We're looking for recovery by diversifying our economy. So what the private sector should put in mind now is that we need two major things. Number one is clean jobs. We need clean jobs, and we need smart jobs. For the clean jobs, we cannot anymore look in future dependence on oil, only oil revenues. If we will not change our business models, our strategies, we will not move to clean jobs, we will still have climate crisis, health crisis, disasters, and so on. Number two is smart jobs. We definitely need to think about future jobs, mainstream the fourth IR, and think about what we can do in the future, and to adapt our strategy and transition accordingly.
Got it. So I think it's an important point that you're making in terms of just making sure that the jobs that we have are also contributing to our health, but also are, let's say, adapting to the current situation. So not only enterprises, but our core jobs and also the people working, and all of us need to adapt to the situation, right? So Miriam, I wanted to throw it back to you to kind of give us some, you also have developed different models and toolkits and a bunch of ideas, and you've been sharing a lot of like thoughts and expertise on really how to transition. What do enterprises truly can do in this crisis? And you have a ton of examples. You can give us some practical example with other companies and what people are doing in Kenya that could help really have a vision in terms of what should we do and how can we help.
No, I think this is very important, and I think in our context, especially in Africa and where we're looking at, protecting lives and protecting livelihoods are going to be two of the same points, right?
Yep.
Because it, whilst we need to make sure that people are doing all the preventions, most of the prevention that they need to do to protect their lives and save their health, they also need to be able to feed their family and protect their livelihood. And because we know that so much of the livelihood is based on the informal sector, it becomes an absolutely critical that whatever businesses will survive will be businesses that will be able to make sure that the livelihoods of their employees and the communities in which they operate are protected. And I think that's going to be absolutely critical, right? So this intersection between the two, or rather, I would say they're the two coins. They're two sides of the same coin. I would say. That's the starting point in terms of that. I think there is what businesses can do today, and there's how to prepare yourself for rebuilding your businesses. Because today, whilst we're talking about continuity and resilience at the moment, we've seen many businesses and sectors that are really transforming themselves, from hotel industry that are now transforming themselves in mini hospitals and quarantine places, and then the businesses that survive and thrive are businesses that are able to not only mourn, grief, and rebuild at the same time. It's as simple as this. It's like, you are looking at the coalition, that of businesses that are going to be able to readapt to these new circumstances of, putting digital at the core of what you are, of, we've seen like beer companies transforming themselves into sanitizers, where, we've seen AABL, for example, transforming and being the #1 producers of sanitizers in Kenya, making sure that we're flooding people with mass sanitation. There is a lot of work that needs to be done, especially in like water supply and hand washing facilities. We've seen designers transforming their industries into making making sure that they're, you know, producing masks. We're trying to get communication companies are all thinking about how do you do to make sure that, you know, we are thinking about getting people to comply to some of these habits that we're trying to get people to do. I think these are the really interesting angle in which, you know, businesses of the future need to look into, because, you know, rebuilding will mean that you're thinking longer term. You're thinking about, you know, how you've been able to survive during this time, how you've protected your employees, how you protected changing the payment terms, for example, to some of your supply chains, for example. You know, like, because we've seen that. If you are a big company, if your payment terms is 90 days, in 90 days, those small companies are dead. So you cannot, they cannot wait. Yeah, they cannot wait 90 days to be paid today. You know, it's not possible. So rethinking payment terms, rethinking, you know, livelihoods, rethinking ways in which you are still boosting the economy, you know, is absolutely critical in terms of where we are today, you know, in terms of what I call protecting lives and protecting livelihoods. So and then thinking about the sectors that are going to be absolutely critical over the next couple of years. And here I'm really looking at, you know, healthcare, you know, anything that's hygiene related, that is food related, because, you know, keeping your immunity and food security is going to be absolutely critical, because that is the only way we'll be able to sustain this this pandemic, is to make sure that people are still eating properly and that they're keeping their immunity level up. So even though we're talking about health, health in this case becomes very inclusive of food companies, of hygiene companies, of you know, water companies, that you are making sure that you are getting to the basic of foundation, to me, of social justice, is being able to make sure that people are really understanding what is health, and health in its holistic sense. And we're going to be seeing so much mental health issues, and that's the reality of what we're talking about, because you know, people are now having to deal with a level of stress that they've never had to deal with.
Confinement,
you know,
it's hard.
How do confinement is hard, and loss of jobs, loss of businesses, and yet, you know, the responsibilities still stay there. You know, you still get school fees, you know, coming to you, and you don't have a job, you don't know where that's coming from, and you don't see clarity on how those are going to be able to survive. So I think it's really important to keep in mind that health in general, in its entirety, is going to be absolutely critical to think about, and an important element of how you're going to be able to drive future businesses to survive. And I think businesses that will be able to understand how to navigate protection of lives and protection of livelihoods will be the ones that will survive. Because we don't know how long it's going to happen. It's going to keep going. So those are just my a few cents to throw in there. And I mean, I've shared with you the toolkit that we've created in terms of you know, what to give to companies, not only in terms of hand washing, but in terms of a framework for businesses and how to protect SMEs and protect livelihoods during this time. And I think it might be good to share with some of the participants that you might have.
Yeah, we'll be happy to share with the participants. If you haven't already signed up, feel free to, and we'll definitely send that over. You mentioned a very good point, and that's what we've been focusing really on here at HTS, right? In terms of building resilience and business continuity. Because a lot of businesses, business continuity, like we often do, it's a second thought. Oh, this is just in case of the worst, but we know it's not going to happen anytime soon. And look how overnight our entire lives change, right? So we are actually helping this business put in place a continuity plan from actually this current crisis, but how we can update it into other crises. So in terms of their system, their human capital, their operation, how do you sustain any other pandemic or even any economic or social change that might happen? And how do you actually, in terms of, you could be in one of these sectors that are crucial right now, where you have a lot of activities and a lot of businesses, or you can be in one of these sectors that are actually really suffering right now. So how do you keep that livelihood, like you mentioned, but also are helping save lives? So we are actually also helping them at HTS do that transformation. How do you manage change? So change management, not only in terms of your core business, but also in terms of what can I be doing? in terms of innovation. So one of these sectors that you mentioned is like, for example, the tourism and hotels. They're no longer who's traveling, who's staying in 5-star hotels right now. No one, right? So how do I reinvent my business? If I was in the transport industry and driving taxis or some of these other mode of transportation, I might not have as many customers. Can I work with another restaurant, do a strategic partnership where now I can deliver for them, or change completely my model where I'm maybe driving health workers or things like that? So how do we help these businesses think about it, shift their model, and also not be, I mean, I think it's hard in terms of where you stand, right? In terms of what revenue you're generating. If you're a huge company, let's say Unilever, and you're a soap manufacturer company, you're a huge, big corporation, you can afford to cut some of your revenue right now to reinvest in people, to help save lives. But if you're a small shop that is barely making end meet, how do you help? So if you can just like go through the spectrum from a large company to a small company, how can they really help? And then I'm gonna pass it to Sulema to talk about how can we all come together in terms of uniting efforts, right? How do we all work together across all of these industries, across, you know, in terms of range of revenue, but also in terms of different means and capacities.
Thank you so much, Hefu, for the question. Yeah, indeed, speaking of resilience, we Africans definitely need to build our own structured, resilient, and unified health system. Not only health system, even food system, because today our health security and food security are at stake. So today we're talking about health crisis. Let's talk about a health system, this robust, structured, and unified health system, especially at a time when coordinated action is vital. So this system, how I see this system? I see this system with 4 or say 3 components, major components. Number 1, my favorite, research and development. Number 2, manufacturing. Number 3, public authorities. So speaking of R&D, research and development, should step it up, definitely. We should, I humbly think that we should put more funding we should allocate more funding to R&D. Yeah, we should, Africans, we should adapt our research to our specific needs and diseases. Yes, we do have specific diseases. We do have Ebola, malaria, things that are specific to us. We should adapt our research to this. We should skill our people accordingly. Yeah, we should pay more attention to the jobs of the future. Again, the jobs of the future, clean and smart jobs. Now, speaking of manufacturing, the second component, this component I see it with 2 sub-components: the production of raw materials, yeah, and the pharmaceuticals, yeah, the pharmaceutical industry itself. Our demand is growing, but not our supply. Yeah, we Africans import about 90% of our needs from Asia. Yeah, look now with the lockdown. Our security is at stake. So, for example, the Central region is importing 99% of its needs. We produce only 3% of the global drug production. So, if we will not change, if we will not do things by ourselves, we will still have the highest prices in the world, because we Africans will have the highest price in the world of drugs. Yeah, we will still have the worst qualities, hygiene standards, regulations. Yeah, if we will not act today, if we will not educate our people accordingly and put in the market skilled people, yeah, to do R&D and to run manufacturers, we will still have, our security will still be at stake. I lost my brother to a deficient health system, yeah, and I don't want other people to face and to experience what my family experiences. So we definitely need the system. Now, speaking of these 2 components, to these components to function well, we need public authority, yeah? We need policies, we need education, we need health system, yeah? We need skilled people. For example, Africans, we have the AfCFTA, yeah? The African Continental Free Trade Agreement, which is great. Yeah? But if this agreement is not, mainstreamed at each state level, this will not be effective. This will not function effectively. Yeah, so this is where we need the state. The state and the public authority should come here and connect, yeah, and build and cement the path for the research and development, for the manufacture, and for agreements and all these things to work well. Yeah. So this system, I mean, in this system with 3 components, I see the major players already working. Yeah, private sector is working, the public as well, and so on. For example, today in Senegal, speaking of research and development, in Senegal they just produced a testing kit, which is amazing. That which extends the private sector can take over now and produce and manufacture what the research and development has produced. So this is the idea. A system of 3 components, and where we connect.
Sulima, can you speak up a bit? It's hard to hear. Yes.
Sorry? Can you hear me?
Can you just speak up a bit? Yeah.
Okay, so I was just talking about these components. I will just sum it up. The 3 components of the system that I see of the health system. Research and development, manufacturing, and the public authority. And it's a platform. I see a platform, and with a moderator, maybe someone institution to lead this platform, and who better than a development institution maybe to take the lead on this. Yeah, this is how I see United efforts. Yeah, that's your question.
Got it. And we've seen a lot of individuals do a lot. We've seen people come together, make different donations. We've seen people come together and actually do a lot of sensibilization, especially on social media. They want people to be aware of what is happening. They want to share either their insights or even do things like this free webinar where we're sharing different information, expertise. We've seen a lot of that come about, right? People doing different webinars and even doing free workshop, free classes. What have you, I guess, Miriam, been doing? Because I've seen you've been very active. This is kind of your topic. You've studied, you've written books about it. What have you been doing with either Business Like Poverty, with Brands on a Mission? What have you been doing on a day-to-day to really add and help fight this this pandemic?
Thank you, Afu. Look, obviously this has been my life work, right? I've spent the last 20 years thinking about hand washing with soap from the private sector, and trying to see what you could do to get hygiene into everybody's household. And I've led the world's largest hand washing movement, reaching 1 billion people in 30 countries across the world. So, I've been thinking about what it takes to get people to wash hands, and I know it's difficult, and it's the saddest part is that obviously everything I've ever wanted around hand washing with soap is happening at the moment, and this is really, it's sad, and at the same time it's funny because it's kind of like I've been trying to get every single world leader of.
It's like I told you.
And everybody is now like on TV and washing hands, and I'm like, I told you so.
I told you guys.
Trying to not be vindictive. But I mean, and to be honest, I just, my biggest hope is that it stays on after COVID-19.
Yeah.
And that we can transform this into a longer term approaches around what is needed to keep hand washing with soap going beyond COVID-19. And so let's break down the task and what I've been up to and what I think will be of interest to anybody in the call. Mm-hmm. So the first one is obviously I'm trying to create and foster a new discipline, which I'm calling marketing for public health, which is how do you infuse marketing with processes and values so that you can really impact public health. And then this is about, bridging the divide between what companies say versus what companies do, so that you can try to drive impactful, sustainable business model. And what I've done over the last year and a half that you've met me at Harvard was to create this framework so that I can transform this into something that I could share, to companies and guide them on how they can make this happen. And it's a very simple framework, which has just, if you've seen HBR this month, I'm on the cover. So pretty good.
Congrats.
Yes. Thank you. Not something that happens every day, but it's with an article called Marketing Meets Mission, learnings from brands that have contributed or tried to tackle global health issues. And that framework is a very simple framework, yet it's a framework that helps bridge that divide. So that's the thing. The framework is also a synopsis of what is in my book, and looking at a variety of case studies that I've looked at, looking from, what can a beer do, a Carling Black Label in South Africa, in terms of trying to reduce gender-based violence in South Africa, for example. And is that not counterproductive when we know that harmful use of alcohol is linked to sometimes gender-based violence? So, what can you do there? What can you do if you're a soap brand and you want to get, 1 billion people washing hands? What do you do? If you are, a bouillon cube and you want to get people to eat more vegetables, what do you do? How do you tackle iron-based, anemia? Anemia amongst mothers, and getting them to eat more green vegetables. What do you do with your bouillon cube? And and I think about what exactly is this that you can work with, and this is what the framework and Brands on a Mission, the book, is about, right? And when I started in Kenya thinking about COVID-19, I started thinking about what was required was a coalition of the willing, but a coalition of the able. And I think, keeping those two words very clearly on, where you would be able to have a core group of businesses who have a genuine interest in selling more soap, in selling more sanitizers, and have a genuine interest in communicating to try to get these at the heart of the conversation, right? So how do you create a business compact that puts together some of these businesses together to answer some of the issues that we're talking about? And then also around them, thinking about, where is the UN family? Where are the community-based organizations and the NGOs? Because we need to get to, some of the poorest areas in the world, or at least in Africa and in Kenya. So that's what we started thinking about, and saying, okay, and where are the digital tech companies that were blooming in Africa? I mean, I'm sitting in Kenya where M-Pesa was founded. I'm sitting in Africa, in Nairobi, where, Savannah Valley is coming from, where all these digital tech companies are, the Jumia of the world are here, the Copia of the world are here. You can do almost anything you want on digital platform. Now, this is the moment to really push, behavior programs through digital. And I think this is where we're at, and we're starting to think about. So I think this is what we've been trying and thinking about, and saying this is what we will do. Is to put together the power of all these private sector companies, big and small, to say, how do you get that going? So we've what have we done? We've done we've in 6 weeks we've reached over 45% of households in Kenya. So that is 1.8 million households have been touched and already
That's
been
great.
thought through. Yeah, that's amazing. We've also looked at all the hand washing spots that are like around the corner, in where you can really see what people where people need water hand washing facilities, and we've already distributed over 7,500 hand washing facilities in places where people can alternate. We're creating a national business compact digital vouchering, where you can have access to some of the essential items that companies would be willing to give you at a very important rebate, for example, and you could still continue practicing hand washing with soap, having access to essential foods. We are teaching people how to also grow their own vegetables at this time, because we anticipate that food security will end up being an issue, and how eating at the core of this. We are teaching people to use local masks and understand how to keep hygiene with local masks, because it's not just about a nice little thing to wear. It's about making sure that you're practicing it with hygiene. So, I think this is what we're trying to do. We've also raised quite a lot of resources and money to expand in all rural villages, in all urban settlements, and thinking about what you could do. So this is all very interesting, and thinking about how you would be able to make that happen.
Yeah, that's great. And I quickly also wanted to share. Go ahead.
Yeah, I just want to congratulate Mariam, because, I'm very optimistic, but now listening to you, I'm full of hope. We will come out pretty well, I think, from this crisis, if we have people like you working here, especially here in Africa, people like you doing great. And thank you so much, and congratulations for all what you're doing, Mariam.
Yeah, thank you. And I think I want to just add that I think it's not enough to just do it in one country. So the reasons why we tied up with Business Fights Poverty was to just immediately say that we could do local action, global learning, and then have a tool ready so we can roll this out in a few other countries ASAP. And I think that's really, really important because it's about collaboration, inclusive, really thinking about how that's actually done. I think that's really important.
And you're doing this, I think, Mariam. You are from Mali, you are married to an Ivorian based in Kenya, working for the whole Africa, and so am I, because I'm Tunisian here in Cote d'Ivoire, and doing, I mean, we are, so is Afro as well, so we are really, our mindset is very oriented to Africa.
We're Pan-Africans, and we have like regional integration is a core piece of it. And I wanted to share some really good example that we've seen and even at HTS that we've been like working with and trying to think about, right? In terms of what you've been mentioning in terms of what companies can do and have they been willing, it's this whole concept again of like strategic partnership. So what we've been doing, and we've been doing a lot of research and trying to put thoughts together into how can you come together and not only development institutions like the UN, the FDB, the bank, the World Bank and all of that, and come together with some private sector businesses, but also local businesses. And the good thing is we have started to see lots of collaboration. So for example, you see governments now reaching out to mobile companies like Orange and all of that to actually do transfer to the most vulnerable population. Because guess what? They don't have a bank account. You have a hard time actually getting to them into their neighborhood and so on. But guess what? They all have a phone. Africa has one of the highest cell phone penetration. So if you have their digit, their phone number, you can get to them through Orange Transfer. So we've seen that collaboration happen. We've gotten in touch with this company, it's like a law firm. They want to make these services available. And now they're thinking about how can they do this without having one-on-one meetings for especially industries where meetings and closing deals in person and shaking hands is a big thing. How can we transition? And I wrote a paper about kind of working from home or working remotely, and how does that transition work, and what do you need to put in place to really be able to still function? So we've seen a lot of these type of partnerships come together. We've seen different people come together and share their experiences through webinars, or we've seen different institutions come together and be like, okay, we're going to use your service because right now we can't get to our people. For example, restaurants, they're working with companies like Glovo that are now delivering. So the hope is that some of these partnership and collaboration is happening, but like you've been saying, it needs to be on a global scale, and it needs to be done in a way that it is structured and that can be managed. And how do we do that? Is by really putting in place the right policies, by putting in place the right structure, and also advising business in the way that they can make this business as usual. Because whether we want to say it or not, I think our livelihood will be affected. We want these new habits of washing hands, of just being more careful with hygiene to go on forever, even post-COVID, even 10 years down the line. I want to keep washing my hands 10 times a day. I want to make sure that I'm drinking juice and making sure that I'm healthy so that, I'm not as vulnerable to other disease. So we want to make sure that the changes that we're seeing right now can last, for a longer period. So we've kind of like reached that 3:45, 3:46. I'm gonna let each one of you share some last like advice, thoughts, and opinions. We have a couple of people that want to share their view on the issue. So then we'll pass the mic and start to answer some questions. Mariam, Suleyma?
Go ahead, Mariam.
Either one of you.
Okay, so to answer the question, the main question of this webinar, how can the private sector fight COVID-19? I think that what the private sector can do is both in the upstream and downstream levels. The upstream by funding, again, research and development. I truly believe in research and development, and the downstream by taking over through manufacturing. No, I really want, so it's the concluding remarks, right? We are ending up, yeah. So I really want to end with a positive note. As I said it, I'm full of hope, yeah. I'm definitely sure that we will find out a vaccine again and the treatment, etc. But my biggest concern is my biggest concern is that if you are able to face other health crises coming, because I'm pretty sure that this black swan will not be the last one visiting our continent, you know. And I wonder if we'll be, if we can afford future risks. For instance, Ebola was a taste for us. Yeah. So now going forward, what I kindly and gently ask the private sector to do is to get into a secret code, a secret code when they will decide future businesses. So this secret code is a politional, an open secret, let me say. It's a 3913, to make it easier, 3913 are 3 out of the 17 UN Sustainable Development Goals. The idea behind this is that the private sector must bear in mind that our health security must no longer be at stake. This is number 3. Number 9 is that we rather need clean and smart jobs, innovate in future businesses, and that definitely we should accelerate action to combat the climate change. So this is for me the main takeaway. 3, 9, 13. We definitely have to think. Thank you.
Yeah. Nabu says amazing work, Miriam. She just said it in the comments. So we're all super proud of you. And I'm really glad you introduced the Sustainable Development Goals, because those goals they've come out a couple of years ago, and it's been really one thing that the big of the worlds like the UN, the World Economic Forum, and all of these huge multinationals have been thinking about. But I think now we realize that we all have to try to contribute toward those Sustainable Development Goals. How do we contribute to not only like our health, but even gender equality? How is this pandemic affecting women more than men? And the fact that now they're staying home, taking care of the kids, and also working, and violence. So there's so many aspects of these Sustainable Development Goals that are important that we should be thinking about. And Miriam, any closing words, advice? Want to share more about your book? Please feel free to join Friends on a Mission and get her book.
Thank you very much. Well, I hope HTS and Nafu, you will do a proper post about the book and the article, and encourage people to join friendsonamission.com, which is basically a movement that I've just created, which is, you know, how to catalyze $1 billion worth of sustainable business model that will contribute to SDGs, right, by 2030. I mean, I had this before COVID-19. I think it's accelerating at the pace that I hadn't anticipated. But I'd like to go back to my opening word, which is, you know, a coalition of the willing, but a coalition of the able. And I think if there's one thing that this crisis might show us in Africa, that how much more resilient we are, and then how much we can find, solutions inside the continent, and be a little bit more reliant upon ourselves. And to say that, there's such a prediction that, there's going to be a carnage in Africa. I would really like us to step up where we know, and put prevention at the core of the conversation, and really get to a point where we can be disciplined, and then we can actually stop this carnage in happening, and actually show the world that we have local solutions that could be of use at this point. So I think, I'm African, I'm proud to be. I am a global voice, in terms of development and the role of the private sector. I believe in making sure that the economies are sustainable, and that, that we're thinking about a growth that is very inclusive, a growth that is collaborative, a growth that is longer term. And I don't think that is possible with just, a one-off show of solidarity. I think we need to go back and think about what global solidarity, Pan-African solidarity is, and less about closing borders, but more about sharing lessons, across the continent and across across the world, of course. So yeah, I'm very encouraged to see you and your platform, and of course, I'm there to support as well any way I can. So good luck and congratulations.
Thank you. So yeah, I totally agree with both of you. My closing word is just one word, actually. It's partnership. And you've just pretty much summarized everything we've been talking about in terms of making sure from one side that we're partnering with local organization, but with different type of companies, but we're also just working together. Rima wants to say hello. Hi. So we also want to make sure that we're working, hi, that we're all working together, and that we're making sure that we're not only just working across different organizations, but we can also make the right partnership and offer local solutions that are adapted to the problem of this continent. And yeah, different groups, different activities, and different experts coming together is really how I see us trying to resolve this issue. So there's Mr. Sétier, who really wanted to intervene and share his view. And we also wanted to open the floor to questions.
Okay, hello everyone, can you hear me? Hello?
Hi, yes, we receive you.
Okay, yeah, okay, so my name is Setil Otniola, as you can see anyway. But basically, I would like to answer the question, but by answering two other questions. So basically, how can the private sector help fight COVID-19? So basically, I would like to raise this question, like, what does the pandemic rose up about us? Like, first of all, about the nature of the structure of our economies, like at the global level and at the local level, like, and especially Africa. So I repeat, what does the pandemic rose up to us about the nature of and the structure of our economies? And the second point is, in which direction are the opportunities are going about innovations? So basically, at the global level, we just can realize how we are not ready about pandemics. And thanks God that because this pandemic is not really deathful, like it doesn't kill too much, but basically there has been in the history many things. But basically, how and what can we do about it? So we have seen like highly developed country have been facing it like really difficultly at the beginning, but now they're facing it. But the issue is about Africa. So the first point is about the health system. We are basically not ready about that. And during all that time, like about innovation, where were the health system about innovations? So that's the issue. And second point, we can see that the major countries that have been able to stop the pandemic really fast, like example, basically about South Korea, because I studied there. I'm from the Korean Development Institute school, but basically how Korea have been able to do that and how Germany is really like managing it, because they have some specific and basics like economic sectors that have been really and well organized about food organization, about health organization, how the government can manage the peoples. But basically I've been raising, and I'm come back to Africa now, that's raising a lot of problems that we have here, and basically what the private sector can do. So basically this issue is going us kind of awareness about the education system, because we can see a lot of like fake news. It's affecting everywhere, but about special Africa, a lot of fake news that people don't want to go and make the test. This is really crazy. By the test, we can prevent everything. So basically education. And then by the pandemic, how can we do education using internet? That's what we are doing now. So why are we using it now when there's a pandemic? So it is raising a lot of issue. So basically you went about a lot of points. That's why I don't want to go back about them and I don't want to talk about them, but basically those are the points about the industrial sectors, about the health system, about the university and how our university are equipped about research. Basically, we can see that like really few, and especially about in this country, from Ivory Coast, so from Côte d'Ivoire, basically there's not a lot of universities that are equipped for research about technology, about other things. So basically there's a need behind all this, and that raises a lot of things. So basically these points, those failures that have been raising up, that's where the private sector can innovate to help us to fight. Not coronavirus for now, but other pandemic if this one happen. So basically, that's what I wanted to say.
Yeah, great. Thank you for your intervention. It was a good way to kind of bring in some of these other sector and how the private sector can help. We have one question also that was typed up. And I think we have another person that also wants to share her opinion. Umu, are you unmuted? Do you want to share now? Should I go ahead and read the other question? Hello, Madam Diaby. Can you hear us? Okay, so I'll just go ahead and
hi.
Hi, how are you? What question or what did you want to share with us?
Okay, I have one question to ask. So thanks to allow me to speak. My name is Umu Jabi. I'm a medical school student. I live in Mali, and I want to know how can I help in the fight of COVID-19 in my country, because hospitals are closed for us because they want to protect us, and more than 50% of people in Mali have no education. So I want to know how can I help in the fight.
Yeah, I think medical workers are super essential, and a lot of countries are actually recognizing it. There's been a lot of talks about medical workers being the heroes of this crisis. They're the one doing the real work, being on the battlefield, although they can be really exposed at this point with this virus. So I think there's a lot of ways to help, but I guess as a student, they might not necessarily want you guys on the front line. But like Miriam and a lot of what we've been sharing is really sharing your expertise. What can you share about the risk of not being hygienic or washing hands? Can you maybe work with some smaller organization to do outreach or to do different exposition, explaining things, or even giving advice on how to keep healthy? These are some of the propositions that I will have. Miriam, as also a health expert, do you have more suggestions for Umu?
Yeah, well, I think, look, I hear you. I'm from Mali, so I am following very closely what's currently going on in Mali at the moment, and I am very concerned. So, you know, a couple of things that we've done with the youth here in Kenya, which unfortunately, I wish I could tell you that exist in Mali, but maybe we could, there is a way to do something similar. We have a model that's called Heroes for Change, which is about, you know, getting university students to be ambassadors and to be the ones that are actually taking the messages into the communities, especially around their trusted environment. Because one of the key things is staying at home, but staying at home is very hard if you're not well supported and that you're not finding ways in which you do that. So, for example, through Heroes for Change right now, through a WhatsApp group, we are creating the largest WhatsApp communities and creating concerts on WhatsApp and ways in which young people can actually get talking to each other, getting musical influences so that they feel connected still and they're passing on the right messages about how to get the compliance. So I think there are ways in which and I may very well share with you what Heroes for Change is doing and see whether this is something that you may want to do with community, with other volunteers or other university workers, and say, like, how do I pass those messages? Encourage other people to wash their hands, encourage other people to wear the mask, encourage them to stay home. What is the right way to do that? Within your environment and within Mali. And yeah, I'm so sorry, I'm so far away.
No. Okay.
Thank you, Mu. Okay, last question before we closed off. It's from Kani. She's asking, how can the private sector collaborate with local and government actors to have the greater impact? To have a greater impact outside from donation and free services? Because again, we've been seeing that a lot of people have been making donation and giving out free services. But here, and one thing that we prone at HTS is sustainable development. How can we healthily sustain these organizations, people, and different businesses so that they can stay in the long term and also help viably the country, right? So what are some sustainable metrics or ways that these private sector and government organization can help? Sulema, you want to take that one?
Yeah, I mean, it's not only about philanthropy, you know. It's not only about, but again, it's about sustainability, as you perfectly said it. We need to think about how to maintain and to create sustainable and decent jobs, and to maintain and to sustain our activities. So yeah, it's not only about again, it's not only about philanthropy. Yeah. I don't know what you said.
Great. Well, thank you so much for joining us. Miriam, thank you. Your expertise and advice and counsel is much needed in these times. Please definitely check out her website, her book, and even her page. She shares so much information. You can even just Google her, Miriam Sidibe, or go on brandsonamission.com. Definitely check her out if you want to know more about what you can do as a brand, but also some tips to continue your activity. Please feel free to also follow HTSpartners. We are sharing a lot of content and information on really how to manage this crisis and your activities in these times of business. Thank you so much, Suleiman, for joining us. Your macro analysis and opinions are always welcome. Thank you, and we'll be back in 2 weeks with another webinar. And see you guys. Have a great week and end of your day.
Thank you.
Bye, everyone.
Miriam, talk to you soon.
Bye.